What is an STI swab test and how is it done? Imagine you're getting tested for sexually transmitted infections and wondering exactly what happens during a swab test. Well, an STI swab test is a simple, quick way for healthcare providers to collect samples from specific areas of your body to check for infections like chlamydia and gonorrhea. Unlike blood tests, swab tests focus on areas where infections often hide and are exposed during sexual activity. These include the vagina, cervix, urethra, rectum, and throat. Once the sample is collected, it is sent to a lab where scientists look for bacteria, viruses, or other infectious organisms. This helps doctors determine if you have an STI and guides the right treatment. The process begins with some preparation. You should wash your hands thoroughly to prevent contamination. Depending on the site being tested, you may need to undress partially. For a vaginal swab, you or your healthcare provider gently insert a small, sterile swab about 2 to 5 centimeters into the vagina. The swab is rotated gently against the vaginal walls for about 10 to 30 seconds to collect cells and mucus. Then, it is carefully withdrawn without touching anything else. If a clinician is doing the test, they might perform an endocervical swab by inserting a sterile swab into the opening of the cervix and rotating it several times during a pelvic exam. For men or women without a cervix, a urethral swab may be taken by gently inserting the swab 1 to 4 centimeters into the urethra and rotating it for about 10 seconds to gather cells. Rectal swabs involve inserting the swab about 1 inch into the anus and rotating it at least twice to collect cells from the rectal lining. For a throat swab, the swab is rubbed firmly across the back of the throat to gather cells and mucus. Once the sample is collected, the swab tip is placed into a sterile tube containing a special preservative liquid. The shaft of the swab is broken off at a scored line so the tip stays in the tube. The tube is then sealed, labeled with your details, and sent to the laboratory. Sometimes, you might do the swab yourself at home if you have a testing kit, but most often a trained healthcare professional performs the procedure to ensure accuracy. Swab tests are crucial because some infections like chlamydia and gonorrhea are localized and might not show up on blood tests. The procedure is quick, usually taking just a few minutes, and is generally minimally uncomfortable. Whether self-collected or done by a professional, proper technique is important to avoid contamination and get accurate results. These tests are part of comprehensive STI screening, helping healthcare providers diagnose infections early and recommend appropriate treatment. Always remember, if you're concerned about STIs or need testing, consult a healthcare professional for personalized advice and interpretation of your results. Following current medical guidelines ensures you get the most accurate diagnosis and the best care possible.